Today, let's learn something about Chapter 11, Childhood Disorder. The first part is about autism spectrum disorder. Autism is often considered a childhood condition, although many of its symptoms persist lifelong. Some people with autism also have mood and anxiety disorders, seizures, intellectual disability, attention deficit hyperactivity disorder, and obsessive compulsive disorder. However, more than 40% of people with autism have normal or above average intelligence, with symptoms that range from mildly to severely disabling. Autism is considered a spectrum. Autism spectrum disorders are diagnosed based on two main criteria: impaired social communication and interaction, and repetitive behaviorals or narrow, obsessive interests. Currently, one of every 68 American 8-year-olds is estimated to meet the diagnostic criteria for an autism spectrum disorder. The prevalence of ASD has risen dramatically since the 1970s, but it is unclear whether changes to diagnostic criteria and wider recognition of ASD have contributed to the increase in diagnosis. 4 to 5 times more boys than girls are diagnosed with autism, although it is not clear whether some of that pattern is because of underdiagnosis of girls. Environmental factors such as parents having children later in life, fever, and infection during pregnancy, and premature births have been linked to an increased risk of autism in children. A huge number of studies have found no connection between childhood vaccination and the increase in autism diagnosis. Autism is believed to be at least partially driven by genetics, but how do scientists know that for sure? One low-tech approach uses twin studies. If one of a pair of identical twins receives an autism diagnosis, the other twin has greater than a 50% chance to also being diagnosed with ASD. Children who have an older sibling on the spectrum also have a higher likelihood of being diagnosed with autism. Nearly 1 in 5 also receive a diagnosis of ASD. The genetics of autism is very complicated in most cases, involving dozens of genes, leading to a unique condition in nearly every person. Recently, however, high-throughput genomic analyses have broadened the pool of potential genes, revealed their roles in body, and suggested possible new therapies. It appears that many genes, each with a small effect, contribute to the inheritance of most ASDs. But such small effects make these genes hard to identify in genome-wide association studies. Scientists are also looking at the rare variants associated with ASD. Some of these rare mutations are in single genes whose impairment is already known to cause intellectual disability and social dysfunction. These genes include FMR1, PTEN, and TSC1 or TSC2, which also code for proteins that help control cell growth and size. Between 50 and 60% of people with Fragile X syndrome, and approximately 40% of people with tuberous sclerosis complex have ASD. Children with a variant of the gene NF1 develop tumors in childhood, and a 2011 study found that nearly 10% meet the criteria of autism. Intriguingly, these ASD-related genes influence a major signaling pathway for regulating cell metabolism, growth, and proliferation, the IMTOR pathway. This suggests a very real potential for treating autism with drugs that target the MTOR pathway. For example, mouse models with mutations in PTEN show traits similarly to humans with this gene's variants: altered sociability, anxiety, and repetitive behaviors. These behaviors can be relieved or reversed by drugs that inhibit the mTOR pathway. Clinical trials of these drugs are underway. And the second part is about attention deficit hyperactivity disorder, and it's also called ADHD. It's one of the most commonly diagnosed childhood conditions. In 20 In 2014, approximately 11% of American parents with a child between the age of 4 and 17 reported that their son or daughter had received an ADHD diagnosis. In at least 30% of those diagnosed with ADHD, the disorder continues into adulthood. ADHD is usually characterized by inattentiveness as well as hyperactivity or impulsive behaviors. Although all young children can be hyperactive, impulsive, and inattentive from time to time, these symptoms are more extreme and last longer in children with ADHD. They often struggle to form strong friendships, and their grades in school can reflect their behavioral instead of their academic ability. Executive functions such as finishing what they start, remembering to bring homework back to school, and following multi-steps directions can be especially challenging for those with ADHD. Young people with ADHD also have lower rates of high school graduations and a higher risk of suicide. No objective diagnostic test exists for ADHD, so diagnosis requires a comprehensive evaluation, including a clinical interview and parent and teacher ratings. Because problems with attention and hyperactive can be caused by other conditions such as depression, sleep issues, and learning disorders. Careful evaluation is always needed to determine whether ADHD is truly the cause of the symptoms. To warrant an ADHD diagnosis, attention and behavioral problems must be severe enough that they interfere with normal functioning. In addition, the behavioral issues must be present in more than one context, not only at home or at school, but in both settings. Although ADHD tends to run in families, no well-defined set of genes is known to be responsible for the condition. Environmental risk factors such as extreme early adversity, exposure to lead, and low birth weight can also be involved. People with ADHD do not demonstrate any obvious brain alterations, but research has found that people with ADHD might have differences in the structure of brain cells and in the brain's ability to remodel itself. Some people with ADHD show unusual activity in brain cells that release dopamine, a messenger involved in rewarding behavioral. ADHD has no cure, but treatments include drugs, behavioral interventions, or both. Interestingly, ADHD medications include stimulants such as methylphenidate, as well as newer non-stimulant drugs. And the next part is about Down syndrome. Down syndrome is named for the English physician who in first described it in 1866, but nearly 100 years passed before scientists determined what caused the condition. Possessing an extra copy of all or parts of the 21st chromosome. People with this syndrome have three copies of its genetic material instead of two. In some cases, the extra copy or trisomy does not occur in every cell, producing what's known as mosaicism. Currently, about 250,000 people in the United States are living with Down syndrome. There is no clear cause of the genetic glitch, although maternal age is a major risk factor of Down syndrome. Mothers older than 40 are 8.5 times more likely to have a children with Down syndrome than mothers aged 20 to 24. Advanced paternal age has also been linked to higher incidence of Down syndrome. And children born with Down syndrome have distinctive facial features, including a flattened face and bridge of the nose, eyes that slant upward, and small ears. They usually have small hands and feet, short stature, and poor muscle tone as well. The intellectual abilities of people with Down syndrome are typically low to moderate, although some graduate from high school and college, and many successfully hold jobs. Other symptoms of Down syndrome can include hearing loss and defects, and virtually every born with Down syndrome will develop early onset Alzheimer's disease, often in their 40s or 50s. The next part is about dyslexia. Dyslexia is the most common and best studied of the learning disabilities, affecting as many as 15 to 60% of all Americans. People with dyslexia have a pronounced difficulty with reading despite having normal intelligence, education, and motivation. Symptoms including trouble with pronunciation, lack of fluency, difficulty retrieving words, poor spelling, and hesitancy in speaking. People with dyslexia may need more time to respond orally to a question and may read much more slowly than their peers. Dyslexia is usually diagnosed in elementary school when a child is slow to read or struggling with reading. Although reading skills and fluency can improve, dyslexia persists lifelong. Deciphering printed letters and words or recalling their sounds and meaning involves many areas of the brain. Brain imaging studies indicate these areas can be less well connected in people with dyslexia. One of these areas is a region on the left side of the brain called the word form area, which is involved in the recognition of printed letters and words. People with dyslexia also show less brain activity in the left occipital temporal cortex, which is considered essential for scaled reading. Researchers believe that the brain differences are present before the reading and language difficulties become apparent. Although it is possible that people with dyslexia read less, and therefore their brains develop less in regions associated with reading. Those with dyslexia appear to compensate for reduced activity on the left side of the brain by relying more heavily on the right side. Genetic analyses have revealed a handful of susceptibility genes. With animals, models suggest that these genes affect the migration of brain cells during development, leading to differences in brain criteria, and dyslexia runs in family, with roughly half of dyslexics sharing the condition with a close relative. And treatment for dyslexia involves behavioral and educational intervention, especially exercise like breaking words down into sounds and linking the sounds to specific letter patterns. And the last part is about epilepsy. If someone also has two or more seizures that cannot be explained by a temporary underlying medical condition such as high fever or low blood sugar, their medical diagnosis will be epilepsy, from the Greek words meaning to seize, attack, or take hold of. About 1% of American children and 1.5% of adults have been diagnosed with these brain disorders. Seizures result from irregular activities in brain cells can last 5 or more minutes at a time. Some seizures look like staring spells, while others cause people to collapse, shake, and become unaware of what is going on around them. The pattern of symptoms and after-seizure brain recording using EEGs are used to distinguish between different types of epilepsy and determine whether the true cause of the seizures is epilepsy or a different medical condition. Seizures are classified by where they occur in the brain. Generalized seizures affect both sides of the brain. They include absence or pituitary seizures, which can cause rapid blinking or a few seconds of staring into space, and tonic-clonic or grand mal seizures, which can make someone fall, and muscle spasms carry out and lose consciousness. Focal or partial seizures are localized to one area of the brain. A simple focal seizure can cause twitching or changing in sensation, triggering strange smells or tastes. Complex focal seizures can leave a person confused and unable to answer questions or follow directions. A person can also have a so-called secondary generalized seizures, which begin in one part of the brain but spread to become generalized seizures. In some patients with severe epilepsy, multiple types of seizures can occur at the same time. Seizures can also accompany or cause intellectual or psychiatric problems. For example, some seizures may suppress the growth of dendrites, leaving the person emotionally unsettled or less able to learn. Treatment for epilepsy are directed towards controlling seizures with medication or diet. For most patients, a single medication is enough to control seizures, although the significant minority cannot get adequate control from drugs. About half of epilepsy patients, particularly those with generalized epilepsy, can reduce their seizures by eating a ketogenic diet, which relies heavily on high-fat, low-carbohydrate food, although it's unclear why this diet is effective. For severe cases that are not relied by medication, doctors may recommend surgery to remove or inactivate the seizures initiating part of the brain. In the most severe cases, if one side of the brain triggers seizures on the other hand, surgeons may perform split brain surgery, cutting the corpus callosum, a thick band of what matter that connects the two sides of the brain. Once their seizures are controlled, people with epilepsy can resume their normal lives. And that's all about chapter 11.